Have you ever wondered how your orthodontist can see everything behind your teeth, roots, and even your jawbone? Well, it's not magic, it's 3D x rays. And trust me, this technology is a total game changer when it comes to orthodontics. So, in this video, we're going to uncover how 3D x rays, or also known as CBCT, help orthodontists plan for treatments precisely, avoid surprises, and give a faster, safer smile transformation. Also, by the end of this video, I'm going to share with you my experience of using the 3D x-rays to check on my teeth. So without further ado, let's dive right in. Alright, so let's start first with the problem of traditional x-rays. So for years, orthodontists relied on 2D x-rays, and those are those flat, black and white images that you see in your first visit in the clinic. The problem with these traditional x-rays is that they only show two dimensions. That means your orthodontist cannot fully see how deep your roots go, how close they are to your sinuses or nerves, or the exact shape of your bone structure. It's just like trying to understand a building's layout with just one floor plan. You'll have an idea, but it's not the whole picture. And in orthodontics, not the whole picture can mean missing out crucial details that can affect your orthodontic treatment. So moving on, let's answer what is a 3D X-ray or CBCT. CBCT stands for Cone Beam Computed Tomography. And unlike traditional X-rays, this scanner captures hundreds of images from different angles. Then, an advanced software combines all of them to form a full 3D model of your teeth, roots, jaw, and even your airways. And you know what's the best part? It only takes a few seconds or even a minute to do the procedure of scanning your teeth. It's like getting a 360-degree virtual tour of your mouth down to the tiniest detail. So, why do 3D x-rays a game changer? So, I listed here 4 points to prove that the 3D x-rays play a huge part, especially in orthodontics. Number one on our list is the precise diagnosis. So, the 3D x-rays reveal what 2D images cannot show. Examples of this are like extra roots, hidden teeth, or the exact position of an impacted tooth. This helps orthodontists plan before they move a single bracket. Second is a safer treatment planning. Sometimes moving teeth blindly can risk touching sensitive areas like the nerves or sinuses. CBCT helps orthodontists avoid these areas entirely, making the treatment safer and more comfortable. Third is customized braces and aligners. With CBCT, your orthodontist can simulate your entire treatment digitally. That means each tooth movement is planned precisely, leading to better and faster results, especially for those who are wearing aligners. Fourth is it helps detect other issues. 3D x-rays can also show TMJ problems, airway obstructions, or bone loss, or even things unrelated to braces, but it's important in the overall health of the patient. Another question is, does everyone need a 3D x-ray? The answer to that is not always. So 3D x-rays are typically used for complex cases like impacted teeth, jaw asymmetry, or surgical orthodontics. But even in regular cases, many orthodontists use it now to ensure precision from the start. When talking about the real world impact of 3D x rays, these x rays have revolutionized orthodontics worldwide. Treatments that used to take longer can now be more efficient, accurate, or even less invasive. Think of it as upgrading from a paper map to a Google map with live traffic. Now your orthodontists know the fastest and the safest route towards your smile and where it should be. So speaking about the 3D x-rays based on my experience, I recently just had my teeth scanned with a 3D x-ray and I shared it with one of my monthly updates. And the reason for that is my orthodontist needed to check the status of my teeth, especially the molars at the back. And it was the fastest experience that I've ever had with x rays because I had an experience with 2D x ray because that's what I used with my first orthodontic treatment. And since I had my second orthodontic treatment, I was able to use the 3D x rays. So basically, I used the 2D and the 3D and I know the comparison of both. And I would definitely say that the 3D x rays are more precise because you can actually see the full 360 degrees in all angles of your jawbone. And aside from that, it just took a few minutes to have my jaw or even the whole structure of my face using the 3D x-ray. So I would definitely say that 3D x-rays is a game changer when it comes, especially with orthodontics. So the next time your orthodontist recommends a 3D x-ray, you'll know that it's not just another test. It's a strategic tool that helps design your perfect smile with precision and safety. 3D imaging in orthodontics is truly a game changer. It's transforming how orthodontists diagnose, plan, and retreat, giving patients like us a better experience and good results with a peace of mind. If you learned something today, don't forget to hit the like button and share it with someone that is thinking of getting their braces. Also, if you're already in your treatment, let me know in the comments below and tell me if you've used the 3D x rays. Thank you so much, guys, and I'll see you on the next video.